Hello, I'm Dr. Mark Tager, CEO of Changewell Inc. One of the greatest issues we face is helping our patients deal with the metabolic changes that accompany caloric restriction for weight loss. I will be explaining the mechanism of action of a nutraceutical product called Capsiate Gold and how it can safely enhance metabolic rate. I will go over the administration and dosage of the product. Most weight loss programs based on caloric restriction usually provide only satisfactory short-term results. In response to decreased caloric intake, the body slows its metabolic rate in an attempt to conserve energy. This often leads to plateauing and patient discouragement. One solution to this common problem is to boost the basal metabolic rate. Capsiate Gold unlocks the power of chili peppers to provide a thermogenic adjunct to medical weight management protocols. Adding the supplement can boost metabolic rate by 50 to 150 calories per day and address the plateauing in BMR that naturally occurs with caloric restriction. Using Capsiate Gold at the inception of our weight loss protocols may decrease the likelihood of plateauing or minimize its significance or its duration. Studies have shown that the active ingredients in chili peppers increase post-meal energy expenditure and lipid oxidation, as well as reduce food intake and body fat. Unfortunately, many people cannot tolerate the pungency or the burning of chili peppers and therefore will not be able to experience their positive metabolic enhancing effect. Capsiate Gold contains dihydrocapsiate, a bioidentical capsinoid found in CH19 sweet chili peppers. This provides the same thermogenic punch of capsaicin, the active compound in chili peppers, but without the unwanted pungency. The efficacy of dihydrocapsiate has been established in nearly 50 research studies. It has been found safe to use. The 9 milligram dose of dihydrocapsiate and Capsiate Gold has been shown to increase metabolic rate, as well as to lead to decreases in abdominal fat as compared to placebo. Capsinoids are able to exert these metabolic effects several ways. First, they stimulate the TRPV1 receptors that line the gut to ignite the body's metabolic furnace. This increases thermogenesis in the skeletal muscles. Activating these receptors enhances both white fat lipolysis as well as brown adipose thermogenesis, and this results in reduced body fat accumulation and improved weight loss management. Here's how it works. Capsinoids activate the TRPV1 receptors on the surface of the digestive tract where they sense heat. There is no absorption of the capsinoid into the circulation. The sympathetic nervous system is stimulated via the vagal afferent nerve. This occurs without any increase in heart rate or blood pressure. There is an acceleration of energy expenditure through enhanced thermogenesis and oxygen consumption. Skeletal muscle burns more fuel, a mechanism mediated by uncoupling protein 3, or UCP3. Another uncoupling protein, UCP1, increases metabolic activity in brown fat. Sympathetic activation also leads to an increased breakdown of white adipose tissue. In summary, capsinoids activate TRPV1, creating sympathetic innervation that leads to increased metabolic activity of muscles and brown fat and lipolysis of white fat without increases in heart rate or blood pressure. Capsiate Gold is offered only through healthcare professionals. The dosage is 3 soft gels, 9 milligrams, once per day before breakfast, providing an equivalent amount of capsaicin in approximately 30 hot chili peppers. In summary, Capsiate Gold is a welcome adjunct to our weight management offering. It has a unique mechanism of action, multiple beneficial physiological effects, and a large portfolio of encouraging research.